Hi, I'm Clarissa Mosley. I'm a psychotherapist and a psychologist, and I want to answer the question today, does therapy work? Now, I feel particularly qualified to answer this question because not only am I a therapist, but I have also partaken in a lot of therapy myself. So I think it's first important to understand what we mean by therapy, because a lot of people are confused between what counselling is, what psychotherapy is, what psychology is. So basically, counselling is any kind of reflective listening that is aimed to support someone in their choices and decisions. Psychology normally uses a therapy called cognitive behaviour therapy. However, true therapy to me is psychotherapy. Psychotherapy itself has branched off into many different streams and formats. The one I am trained in is Gestalt therapy. I find it to be an incredibly effective form of therapy, which I myself partook in as part of my training and perceived myself to have an exponential growth across those 3 years of training and therapy and experiential work that I did. Now, obviously, people go for help because they cannot work out things by themselves. But over the course of time in your therapy, wouldn't it be ideal if you started to embody, you started to really know and understand the tools and the techniques and the processes by which you could examine, inquire, contemplate, and learn more about yourself and how to reflect on yourself in a healthy way, not from the point of view of that nasty voice that is in your head telling you can't do anything right. So let's duck back to what most psychologists do, which is called cognitive behavior therapy. So CBT, cognitive behavior therapy, focuses on reshaping thoughts, dysfunctional thinking patterns. Our thinking and our thought processes can regurgitate and even sometimes recreate emotional states within us. So cognitive behavioral therapy works on that very top layer of your thinking and thoughts and how that interacts and how you're behaving during the day and the things that you are feeling and the emotions that you might be perpetuating by virtue of your thoughts. Psychodynamic therapy, on the other hand, while probably incorporating many aspects of cognitive behavioral therapy, looks at deep-seated behavioral patterns that are rooted in the personality that may have emerged through childhood. We can almost look at psychodynamic therapy as making the unconscious conscious. So obviously it's digging a lot deeper than CBT. But the golden question is, does it really matter what kind of therapy your therapist is doing? Because there are many different forms of therapy. There's ACT, there's DBT, there's CBT, there's ABCDEFG. I mean, there is a lot of different kinds of therapy. Does it matter what technique your therapist is using? Or is it more important who they are? In fact, research shows that it's neither. While there might have been a lot of money thrown at researching short-term solution-focused therapies that insurance companies, for example, can endorse as an effective form of treatment for their clients, time and time again, studies have shown that the most important factor is actually the rapport or the therapeutic alliance, that is the connection that you feel between yourself and the therapist. Do you feel that they hear you? Do you feel that they have some understanding or at least a willingness to understand your particular situation? Do you feel safe, heard, unjudged, held? Do you feel that your therapist has empathy towards you? Do you feel that your therapist can also challenge you just enough to help you get out of dysfunctional patterns? These factors are very individual. One therapist's empathic resonance with one client who might go away and tell their friend, oh my goodness, I have the best therapist. Their friend might go to the same therapist and wonder what on earth they were talking about, because the goodness of fit between that individual person and the individual therapist is the golden factor that cannot be predicted until you've actually been there. I always recommend that people do a lot of research on any practitioner they're going to. Endorsements are great. They are incredibly valuable. Being referred by your general practitioner might also be valuable. But it's also important that you have a very good sense of what you're signing up for. You, after all, are parting with your valuable time and money. And so a rule of thumb is that if by the third session you're really not feeling there's a vibe happening between you and your therapist, you may want to either bring that up in therapy and see how it is responded to, or perhaps do a little bit more research again. But in my humble experience, my experience of being a client is absolutely invaluable for when I'm working with people. Not just that I understand what it's like to be sitting in that chair under the spotlight, but also because it means that I am aware of what my stuff is and what their stuff is. And it's very often that it will still happen, that something will come up and a client will come in with a situation that echoes something in my life. And I have to note to self that where that boundary lies between their experience, their material, and mine, so that I don't do this thing called projection or transference and put my thoughts, feelings, judgments, appraisals, how I worked with my situation onto that client. And while having been theirs is incredibly valuable in life experience, it doesn't necessarily mean that my been theirs are going to help you get there. So we've talked a lot about what your therapist needs to have potentially for your therapy to be effective. But what about you? One of the most important things about therapy is timing. Where are you in your life? Have you decided to go into therapy because a life crisis has hit? Well, this often happens. But what this means is that your therapist really needs to attend to help you with that crisis first. Now, it can get interwoven with looking at what factors are in your life and your personality and your environment that are playing into this particular crisis or other ones that may have come before it. But some people come into therapy in such a crisis where things have built up for years and there's an absolute pile of things and issues to unpack and recount that we can really only deal with almost putting out fires as opposed to getting anything really done. Now, this is not to say that you don't go into therapy when you're in crisis, please do. But it's to level the expectations around what can be worked with, how long it might take, and what your expectations might be from therapy for yourself. The actual effects of your ability to sit with your strong emotions, to dig under the surface at the places where you may be far from perfect or actually truly good enough. The reward for your dedicated introspection, for your commitment to doing the work to transform your life and yourself into a life worth living that can get in contact with the gritty, with the unpleasant, with the unattractive parts of yourself and others. The rewards of this are ongoing. They are often unseen. Most people report feeling better. You're doing your work, I hope, for your own self-improvement, but also that your energy and your interactions with other people become more authentic, more wholehearted, and more pure. I don't know many people that have had good therapy that have regretted it, unless they are intimately tied and desperately holding on to their own sense of being a victim to life. And then, sure, you can use therapy to reiterate that story. But most people, and myself included, I've found that therapy has given me so much more in my life. It's given me greater tolerance. It's given me the ability to see the good in many things. It's given me the tenacity to push forward. And it's given me the ability to regulate, to balance, to experience gratitude, and obviously to be far more supportive towards other people. Most people who have done their own self-work have improved their lives. They are more in contact with who they truly are. They have dug down through the layers of their ego, of their dysfunction. In examining yourself, in getting rid of the negativity and the drags and the low points to the best of your ability, and maybe not forever. Life is going to throw you more curveballs. There is no guarantee that you opt into an easy peasy life. But you have got greater ability to handle it, to see it for what it is, to be supportive to yourself, and to be supportive to other people. And so I think everybody can benefit from some kind of therapy, introspection, self-work. And many people can benefit from a lot of this kind of work, done in a wholehearted way. Done in a way where you have an actual desire to know the truth about who you are. And it's not usually bad. To know how to be more integrous, to know how to be more empathic to yourself and others. Because this is a dying trait in today's age, is empathy. To have compassion, if not empathy, to have compassion. And to have this toroidal field where your goodness and what you have done actually feeds back out into the greater field. And this is actually how it works. We don't need to worry about our individual souls having a great afterlife or other afterlives, because anything we do now has an outflowing effect on the greater whole. Because think about it. If everybody genuinely tried to do this and went, how do I become a better person for the greatest good of all concerned, not just for me? Like, most people will enter therapy to ease their own pain, but in the process, they're actually not just easing their pain, they're lightening the load of the trauma of the whole world. And if you look at it like an ocean, you know, the ocean is full of junk. If everybody took all the junk out of the ocean, we would have clean ocean. If everybody took all the junk out of their consciousness, we would have a clean consciousness. Everybody would be happier, they would treat each other better, and the world would be an amazing place. So clearly, I endorse therapy as a pathway there. I hope you've found this video interesting. If you have, you're welcome to give it a like. And other than that, I hope you have a beautiful day and that you value what you have done for yourself, even in paying attention and watching this video. Thank you.